Good morning all. Pat Zemer here with MagnaWave. Glad to be with you this morning. Good morning, Janet. If you have any questions, we're here to answer any questions that you may have. Just put them in the chat box, and as I said, we'll be happy to answer them at that time. A couple of things exciting are happening around here. The MagnaWave Express is on the ground, so we'll be traveling around the country, putting on seminars, demonstrations in various areas of the country. We can be more than happy to come to various areas and have clinics, work with the practitioners to have a information clinic for their customers and clients. So we'll be looking to do that. We're trying to establish the first trip at this point. At this time, it's looking like it's either going to be Tryon, North Carolina, or Kansas City, Missouri, as we're working through a couple of different things that are going on. So that's what's happening with the MagnaWave Express. I'll be giving you some pictures here shortly so you can keep up with what's going on there. Again, any questions, put them in the chat box and I'd be happy to provide an answer as best I can. I did have a question that was asked about 2 months ago. I used a double loop on the knee of a gentleman with knee pain. He got a little relief, but nothing major. He called, made appointments for other family members, and had me do another round on his knee again. Double loop, probably 10 to 15 minutes. This was probably a month ago. He called this morning and said he has had pain ever since the last treatment, and it is progressively getting worse. And she wants to know, the person asking the question wants to know what to do next. Well, you know, that's a very good question. Typically, when treating someone, if they're having an issue, you need to kind of look back and think about what's causing the issue. Where is it coming from? Was it an injury? Is it something anatomically wrong with the body, a pinched nerve or something like that, a spur, whatever it could be? There's a lot of different things that are going on that are causing some of these issues. And so someone comes in and says, well, I'd like to have a treatment. So you treat their knee or you treat their back, and it doesn't seem to get any better. Two things. Number one single treatment is not going to change the situation necessarily. Sometimes it might take several treatments to really adequately get at the situation that you're dealing with to make it better. In some cases, and I've had this a lot, if you treat someone or an animal 3 or 4 times, let's say, and nothing changes, certainly it's time to see a doctor and to see what else could be going on. A person could have several things affecting them. It could be a back issue that's causing them to walk differently, that's causing them to have knee pain, and it just continues to get worse. So you need to look a lot of different situations when you're dealing with these types of indications. So certainly that's how I would approach it. I would certainly find out what happened, how it happened, why it happened, and then make an assertion as to what you feel would be the next thing to do in that particular instance. But again, it could take several different treatments in many cases to find out what's going on with a given indication. So I hope that helps when you're dealing with those types of situations. Any other questions? Just throw them here in the chat box. Friends, thank you for being with me this morning. Let me see here. Let me go down and see. I've got some other questions here that we might want to deal with. Kids left the gate open. Pony got into feeder, calves feed and corn. Afraid of founder. Would MagnaWave help them or maybe hurt? Well, you're going to help the blood circulation. You're going to help the oxygenation. You're going to, if you have a founder situation, you certainly want to keep the animal as comfortable as possible and to help it get into a situation. I would certainly, in that type of situation, consult with the veterinarian, tell them what happened, see what their initial recommendations might be as far as what to do to avoid the issue becoming serious. Can MagnaWave be effective in helping out that situation? Most certainly, but that's one of the things that you probably need to check with your vet first and talk about what's going on and what needs to be dealt with. Okay, let's see. What would be the protocol for working on a toy Aussie with congestive heart failure? Well, the size really has nothing to do with it. I mean, you know, you may control your intensity based on the size of a particular person or animal, that type of thing. But for example, yesterday, now animals are different. Dogs are different than cats. Horses are different than dogs. But when you're yesterday, for example, we paid a visit and we're doing a demonstration and talking with the folks. If you want to look this up on Facebook, go to Lil Bub. It's Lillian Bubbles. It's a very popular cat, and 2.9 million fans and friends of this particular cat. And the cat weighs only 4 pounds. And but we were able to treat the cat just to show the demonstration of how it works. It's got some joint problems, arthritic type of problems because of some abnormalities from its birth, and some other very serious types of bone issues. It's a dwarf cat. Need to check it out. Lil Bub on Facebook, and you'll be very amazed and interested at the story of this particular cat and dude, the cat's dad, if you will. The cat came here from outer space. It's the whole thing. But anyway, check that out. But when you're dealing with size, we treat our little bitty 4-pound dog, I'd call it a Pee-wee O'Cherise, and we treat her with as necessary if she's not feeling good or something like that, on a very low setting. But again, they're not going to let you treat them if it's too much. So you would treat the animal for congestive heart failure. Again, you want to talk to the veterinarian, but and just tell them what you're doing and get their thoughts. But you're talking about improved oxygenation, improved blood flow, which can be very beneficial to a heart condition or someone who's experiencing that type of thing. Not saying that it's going to heal anything. We don't say that. We don't make. But can it provide comfort? Can it provide better oxygen? Potentially provide better oxygenation and blood flow, which could be beneficial to the overall health of the animal. That's something that certainly is possible and available. But in this particular case, because of it, depending how long the animal's had the condition or what you think from that perspective, consulting a veterinarian is certainly a very good thing to do at this point. Let's see, we have a question here. Let me pull it up. Okay. Christy asks, how often should a repetitive movement injury be treated? Only when it gets aggravated, or should weekly or every day, 2 to 3 times per week, schedule be set up? Well, you know, it depends on the injury. You know, one of the things we basically often say is you treat as often as necessary, as long as function continues to improve. So again, let me say that. Treat as often as necessary and as often as the function, I'm having trouble with that one this morning, continues to improve. So if they're improving, treat. And then once you reach a plateau, then we treat as often as necessary to maintain the plateau. It's not a secret number, and you don't necessarily want to wait for it to be aggravated. If you can treat once a week and it doesn't become aggravated from the repetitive movement, then you're ahead of the game. If you treat and it's pretty good and then you wait for it to come back, sometimes you have to start over the whole process to get to the end of it. So we have that. I experienced that with horses in the beginning when we first started the MagnaWave brand and MagnaWave business. We'd had horses at the beginning, we'd treat them every day if they're in competition, Wednesday, Thursday, Friday, and Saturday. Wednesday, Thursday, Friday, and Saturday. Then we learned that we really only needed to treat them Wednesday and Friday, and maybe Saturday if there's something going on. Some horses only needed to be treated on Thursday, and it'd carry them through the whole weekend. And you know, they're having situations with training, with jumping, with racing, whatever the situation may be. And so again, you treat as long and as often as you can, as long as the function continues to improve. And then you treat as often as necessary to maintain the desired result that you were looking for or that you achieved. So I hope that helps, Christy. Great question. If you'd like further explanation, just post it up there and I will take care of it and answer your questions for you. Okay, let's see here. Let me take a look over here. Again, any other questions, just put them in the chat box and I'd be happy to take a look at them. Let me take a look. Oh, what brand of CBD oil do you recommend for a person with depression, anxiety? We have a couple of brands here at MagnaWave that we do work with. And most CBD oils have been shown to be very effective for relaxation. And it's not a magic CD oil that works with depression or anxiety. But if you go to MagnaWave.com, you'll see some of the products that we have available through MagnaWave, and be more than happy to discuss that with you should you have questions. It's amazing when you start talking about hemp and CBD oil, how effective it can be for depression, for pain relief, for relaxation, many different things, for small animals, large animals, people. Very effective and really growing in popularity at this time. A lot of states are changing their regulations. The federal government's working on taking hemp off of the Class 1 restricted drug list, so it'll be more easily attained across the country in all states, as is instead of like now there are some states that don't allow it, other states do. But take a look at the site there, and we'd be happy to answer any questions on the site. That's hempmagnawave.com to have a look at the Ananda products and some of the other products that we have available here at MagnaWave. Okay, let's see, another question. Yep, Aaron, thank you for putting up that link so people can go there and check that out. All right, let's see here. Any other questions that maybe we can look at this morning as we move along? Someone searching for a practitioner in the Tampa Bay area. Got a inquiry from a client. Her gelding is lame in one shoulder. She was asking if they should go to the vet and get a lameness exam and then MagnaWave, or just have me MagnaWave. Well, certainly if they have a lameness issue, I would recommend that they check with their vet. Is it going to be a problem for you to MagnaWave before the vet sees the horse? Typically it's not. You just want to try to make the horse feel better, relieve any pain that it's having, and maybe help relieve the lameness type of situation. But if they want to consult the vet and need to consult the vet, that's certainly the thing to do. And people play that both ways. There's been a lot of people that say, you know, my back's hurting me, I'm going to go to the doctor next week, but I want to relieve the pain today, and will you help me do that? And people can help with that and get some pain relief and relaxation from it, and then go to the doctor, because there could be something else, as Dr. Jerry Dreesen pointed out in one of the questions today. There's a lot of things going on, and you need to be able to deal with the various situations, whether it's shoulder pain causing you to walk differently, or back pain causing you to walk differently, which makes your feet hurt or your ankles hurt, whatever the situation. And you need to be able to be very open and understanding what particular situation that you're dealing with when you're doing that. So my recommendation would be, in that case, to contact the vet, tell them what's going on, ask the vet, can I MagnaWave? Can I start MagnaWaving and then you're going to come check it out? Or shall we treat it a couple of times and see how the horse does and then report back? So there's a lot of different ways to approach that. And let's see here. Treated a dog with luxating patella. Had a vet consultation today, and surgery is recommended. Well, you know, and I'm not saying that the vet, what I'm saying is I've been in situations with veterinarians, with dogs with hip dysplasia. Let's just talk about that for a second. And people want to know if they should have surgery, and the surgery is sometimes recommended. I was with a gentleman from New York at Dr. Marty's office a few years ago, and this fella had 2 Great Danes, and one of them had very serious hip dysplasia, and they wanted to know what to do. And one veterinarian recommended surgery. And now you're talking about a Great Dane with size, so it means you got to carry the dog a lot and move it around a lot. And Dr. Marty approached it from the standpoint of, why don't we treat its hip first with the MagnaWave, see if we can provide relief, get the dog in better condition, and then evaluate whether or not we need the surgery. Because as you know, in many cases you have surgery and then you carry, or you're doing various things, and then you have to have surgery on the other area or the other hip or the other patella area, and to deal with it like that. So surgery is certainly not the only thing that's out there. A lot of docs who are learning and the benefits of how MagnaWave can be beneficial for pain relief and inflammation reduction, and how that can impact someone's feeling better. My sister-in-law has had two knee replacements, and so until she got to the point that she absolutely had to have her knee replaced, she used MagnaWave for almost 2 years to help her deal with the situation, because she wanted to put it off as long as she could and try to maintain some comfort. There's been people that have been able to avoid for a great period of time the going under the knife necessarily. Other people, it's using the product, using the MagnaWave to help them better deal with the situation until they can have it repaired. That was on the TV program when Wave 3 came and discussed the opioid crisis, that a lot of people are looking for ways to ease the pain and make people more comfortable to stay away from opioids. And part of that interview was Jeff Arnsberger, and interestingly enough, Jeff had his hip replaced, had a hip replacement, and we were treating him for several months and giving him some relief because they had to schedule the surgery. They had to, and of course he was getting different opinions on what was going on, so the MagnaWave was very beneficial to help him deal with the pain and be able to work until he got to the surgery. And then he used the MagnaWave afterwards, and he discussed that he was off of his pain meds in just a few days, as opposed to the length they thought it might take because of having the hip replacement. And he's an athlete, he's a physical therapist, and interestingly enough, he's got bad knees, bad hip, and he's just really been in an uncomfortable situation. And today he's having his knee replaced, and so he's been using the MagnaWave to help him deal with the pain until he gets to the knee surgery, which is today, and then he's going to start right up and help his knee with the inflammation and pain relief and the drugs that he will need to take there. So that's how we look at it. Is it going to eliminate the need for surgery? Not necessarily, not every time. Can it put off the need for surgery? Perhaps, and it's certainly something that is important to deal with pain and inflammation when it comes to these types of injuries and things that we're dealing with. Okay, let's see. It's got a question here. Just tuned in. Just tuned in. What's MagnaWave? Well, Karen, we're glad you're here. Thanks for tuning in. MagnaWave is a pulsed electromagnetic field therapy device that creates a magnetic field that penetrates through the body. If we were treating the shoulder here, we'd have a coil placed on the shoulder, and it would go all the way through. It would penetrate the tendon, the cartilage, the muscle, the bone, and help relieve inflammation. What it does is it makes the cell wall more permeable, so the cell can better take on the oxygen from the body that's available to it. And if you can improve the oxygenation of the cells, then you can improve the ability to reduce inflammation. And if you reduce inflammation, you take away pain. And so that's what MagnaWave is. It's an inflammation reduction device for pain relief, allowing the body to better heal itself. Great question, and that wasn't a setup. Karen, we're glad you're here, but check out our website, MagnaWave PEMF.com, and you'll be able to see what this wonderful device can do and how it is used by folks, and for people to have a look. So check that out. Great question. I hope I gave you an answer that will help you better understand what we're doing. Let's see. Which Karen has another question here. She says, sounds good. Will it help with fibromyalgia? Yes. A lot of times fibromyalgia is a tough one because it has a tendency to move around the body, so you got to treat different areas at different times. So we're going to kind of chase the pain. But in that type of situation, when you're having pain, you have inflammation, and this helps deal with inflammation and to relieve some of the pain. Is it something that you use one time and you're finished? Unfortunately not. A lot of times some people that have conditions as you're describing, they get into a routine, they treat themselves, they're treated several times, and then they're treated, as we always say, treat as long as function improves, and then treat as much as necessary to maintain the function. But it is good. You can take a look on the page there, and on the Facebook page and the MagnaWave website to learn more about how this device can help with what you're dealing with. Karen, great question. Let's see. Link, please. Okay. Aaron, there you go. Aaron, so I put that up there. MagnaWave PEMF.com. All right. Any other questions, folks? I'd be happy to answer them for you this morning. Someone asked the question, I have a human client who's asked if they can benefit from taking magnesium. Any thoughts? Well, need to know what the situation is. Are we dealing with cramping? Are we dealing with whatever it may be? Magnesium is a great supplement, and it can be very beneficial. Check with your doc or do some reading on it. Search online, Google it, and see MagnaWave or not, how magnesium can be beneficial for whatever there is that they're talking about using it for. Let's see. Any other questions? I'd be happy to answer them. Let me see if we've got anything else here. Is there a protocol for treating someone who has blood clots in the legs? Well, you should always, if you're treating someone who has blood clots, first blush would be don't treat over where they have blood clots. You don't want to necessarily cause them to move or do anything like that. You need to, the client needs to consult with their doctor and see what the doctor has to say. Now, if you're treating someone's shoulder and they've got blood clots in the legs, you're not going to be doing anything as far as pressure, as far as pulsating in the leg area like that. I mean, if they've got blood clots and they're worried about them moving, their doctor's going to limit what they can do. They're going to make sure they're on a medication that either keeps them from building up. So there's a lot of things to consider when you're dealing with blood clots. And so it's always best to have them consult with their doctor, tell their doctor what they're doing, and then treat accordingly. In some cases, you'll have to help inform the doctor as to what we are doing, and so you could treat the low back or you could treat the shoulders if they're dealing with blood clots in the leg. Always consult. It is, if they're letting the person walk and talk and do all this kind of stuff, then you want to treat their low back. There should be no indication there that would be a particular issue, but always check, always refer. Great question. Let's see, take another look here. Has anyone used HydroWave for white line and the Zoom paddle? Thinking we'll try with my horse. Well, the HydroWave helps improve the oxygenation in the blood. What HydroWave does is it's a product where you have small molecules of silver, nano-sized particles of silver that are less than 1 part per million, making them not a heavy metal, and it will not leach to the body. In fact, it will pass from the body. But the water goes through a process where the silver or the oxygen in the water bonds to the silver, and so when you drink the water or take it in, it passes into the bloodstream and then can fight bacteria and fight things going on in the body in that fashion with the little clusters of oxygen. So could that be beneficial to the white line disease or white line problems? Certainly, again, you can check with your veterinarian, but if the oxygenation would be beneficial, certainly we've had a lot of folks use the paddle or the MagnaWave with various attachments on horses having that type of situation, and with good success to aid the overall situation of the body better healing itself and getting about the healing process. Great question. That's how the HydroWave works. Let's see, we've got a couple other questions here. Let's see. Marissa asks, how many treatments does it take to roughly heal scar tissue in a horse's leg from a previous injury? Well, It's hard to say how many treatments it would take. The question that becomes, how long has it been since the injury occurred? I have had a lot of situations to where there's a buildup of scarring, and the use of MagnaWave will make the scar tissue more pliable, so it does not cause a problem. If you use it when the injury occurs, then a lot of times it helps keep the scarring down, making it again more elastic, but it's used quite often in surgical situations, plastic surgery, to number one, relieve the scarring, the pain of scarring and inflammation, but to make the scarring less visible and to help the healing process there. So again, if it's a buildup of scar tissue that's been there for a while, it's going to be harder to get out. We once had a racehorse in Ocala, Florida, that had scarring on its ankle, and it was firming up to the point that it was hurting the flexation in the area. And what they did is they treated it regularly, and they had to treat it several times, and it made the scarring area didn't really relieve it or make it go away, but it made it much more pliable, so the horse was able to use its body, use its ankle without pain, and had the range of motion that they were looking for. So that's basically what can happen. It can help reduce scarring, it can make the scarring more pliable so it doesn't cause issues, but it also has to do with how long the scar has been present. Hope that helps out, Marissa. Great question. Happy to do it and answer it. Let's see. Let me pull this up. Marissa asks, has there been any study that shows MagnaWave will help with vertigo? If you go to PEMFprofessionals.com and search vertigo, you will potentially see studies that have been done for vertigo. I don't know that there is I'm not aware of a specific study in America using our type of therapy for vertigo. I can give you my own explanation that I had some vertigo, and they determined that it was from some inflammation in my head, my sinuses, that was causing this. So I was taking some medication, but I was also treating myself daily, and I got through the whole process pretty quickly, or rather quickly, utilizing the device along with the medication that they were giving me to help relieve the problems certainly caused by vertigo. But I'm not totally aware of any studies, but I go to PEMFprofessionals.com and search that situation and see if there's any specific studies out there. You could also Google it. I'd do it. I could do it now, but it'd take a few minutes for me to do it and pull it up. But you could Google it, PEMF vertigo, and you'll see of course, there'll be a lot of companies that'll tell you that this will treat everything, and it will treat almost everything. But take a look and search it, and perhaps you'll see something you like. But we'll also take a look at it and get back to you. Aaron, if you make a note, we'll take a look at that and see what we can find with regard to the vertigo situation. Great question, Marissa. Okay, let's see. MagnaWave should help a hematoma, right? Yes. It's going to help the blood flow, it's going to help the oxygenation, so it's going to help reduce any inflammation or things that are going on. You want to make sure that any bleeding has stopped, that there is no continual bleeding in this type of situation. But by improving oxygenation and improving blood flow, you can help those types of conditions better take care of themselves, or allow the body to better take care of itself with those types of conditions. Good question, Amber. Thank you. A lot of good questions this morning, and we're excited about that and looking forward always to answering the questions. Any other questions, folks, just put them up there and I'd be happy to take a look at them. And let's see. Oh, that's the hematoma. Same question. I'm by myself here this morning, so I've got to kind of look through and see what we're dealing with. Let's see. Does anyone have a fertility testimonial? Well, we've asked that question of the practitioners. We did some work several years ago in Ocala with a fertility veterinarian, and they were very excited with, again, the improved oxygenation, the improved circulation through the ovaries, and what they were doing to deal with the fertility or to deal with the insemination that they were needing to do, and so on and so forth. So there's been a lot of stuff out there discussed with regard to fertility. Of course, we've had all kinds of people that have told us that they were looking to have a child, and they treated, and all of a sudden they were having troubles. They were having trouble becoming pregnant, and then they started doing regular treatments, and all of a sudden they became pregnant. Well, again, all I can go back to is sit back and think about, if your body's in better condition to live happily, and your blood cells are healthy and happy, and your blood oxygenation is good, a lot of good things can happen. I always say good oxygenation can work miracles on many different diseases, many different things that folks are dealing with. Let's see here if there's anything else. How would you describe the difference between MagnaWave and the Bemer? Well, both devices are PEMF, both are pulsed electromagnetic field therapy. The Bemer is a very low power device that takes longer treatment times, and the result is not as rapid. The Bemer gets into an area, they deal in milligauss and microtesla is the way they describe the Bemer. We deal in Gauss, in thousands of Gauss, not 100,000 milligauss, so we have much more Gauss energy delivered with our device as opposed to a Bemer type of device. And so if you're looking for a rapid response like right now, then you're going to look at a device like MagnaWave that is higher powered, that can produce a massive amount of energy to the area to help the situation have a quicker, more rapid response to what you're wanting to achieve. The Bemer is there are various marketing strategies out there, and the Bemer is marketed on a networking or a multi-level platform. So a lot of the money and the cost of a Bemer goes to pay all the downline and all the people involved. And so I'm not saying that the therapy, all magnetic therapy, is good. You just need to look at how quick it's going to operate, how much you're paying for what you need to have, and where those funds are going and how they're used. So that's the basic difference. We're much more powerful. I have a tendency to say we'll accomplish in 10 minutes what a Bemer will accomplish in 2 weeks, and in terms of getting after certain indications. Now, that's not to say that someone couldn't get on a Bemer today and feel much more relief, and they're happy because they say they have that, and that's fine. But I can tell you that people who have used low power units, I've been doing PEMF since 2002, and for the first 6 years or so I was doing all low power stuff. Worked great for relaxation, worked great if you could put it on an animal or a person every day for 30 minutes or an hour, and have the time and the patience. Patience is great to work through some type of situation. And I can't tell you over the years how many times people would have this equipment and then they weren't using it because they had to use it every day, or they didn't see the rapid result that they were looking for. We quite often have people who use a MagnaWave and to get the result that they're looking for, and then use a lower power unit of some type to help maintain and hold on to the result that they got. For example, I tore my MCL here a few years ago moving into one of our offices, and we do have another question here, but I used the MagnaWave immediately, and I used it twice a day to help keep the inflammation down and really relieve the pain. Then through the day I used the MagnaWave LP device, put it on my knee, wore it in my pocket to just help maintain the pain relief and to help the healing process along through the day when I couldn't be on my MagnaWave. So they're very complementary in many cases. Sometimes people will use a MagnaWave and pair it up with light therapy, with red light and white light therapy to help do that, or they'll use it in conjunction with microcurrent therapy, or TENS kind of therapy, or vibration. There's a lot of different ways, and they're very complementary, or laser, to do things in a complementary fashion to achieve the results that you're looking for. Okay, let's see. Let me pull this one up here. When treating a back injury and soreness occurs after treatment, would you lower the frequency on the next treatment, or is it normally due to the toxins leaving the cell? Well, you always want two things. Yes, a person can have some detoxification, and what you want to do is always treat. And what people a lot of times will do, you won't have this with a horse. If you are too intense on a horse or a dog, they will leave. They will get up and walk away, or they'll walk away from you. Now, moving around is kind of like someone's rubbing your back. Oh boy, that feels good. Do that. Yeah, rub my back. But treating a person, and I learned this the hard way in the beginning. I'd put it on a gentleman and do treating his back, and he'd say, "Oh boy, that feels good. Yeah, hurt me good. Turn it up a little bit." Well, you turn it up, and all of a sudden you're giving them the result. They're giving them a deep tissue massage, and a lot of times when you have a deep tissue massage, you're sore afterwards, and then you feel better later. So, two things. Could be the release of toxins causing that. Some people are very toxic and they're uncomfortable with the treatment from the get-go. And 1 out of 100 people has that resistance to electricity or the high power voltage lines, or they don't like sitting in front of a computer, or things like that cause them a level of discomfort. And so you always have to deal with that. So I always make sure that the person is comfortable. If I turn the device up and I say, tell me when you feel it, or when it starts to nip at you a little bit, and they say, that's fine, I can take that. If they say I can take that, I turn it down. You don't have to bring pain to the situation. So to answer your question, yes, I would turn the intensity down on subsequent treatments, because it's not always about how much power is being delivered. It's about how much energy we're putting into the area comfortably to help oxygenation and blood flow. So it could be a little bit of both, but that's the situation. And every person is different. You want to know how, that's where we have a form that we ask questions of people to see what they're dealing with and what they have going on. Great question. Let's see here. Got another one. Let me pull down here. Can you tell the difference between a MagnaWave and a stim machine? Yes. And I need to pull up my notes here and look at something real quick, so I say this properly, because I get them confused once in a while. Let me do this. I'm sorry, but let me just pull this up so I get it correct. Okay. Okay. Stim are TENS, if you're talking about TENS. There's microcurrent and then there's TENS. Microcurrent promotes healing, and TENS machines, or stim, if you're calling STEMS machines, help relieve pain. So the difference is that with a MagnaWave, we are relieving pain. With a TENS machine, and I'm presuming that you're talking about TENS, we go to where you have a particular spot and we work a particular muscle group to pulse it with the electrical current to help get some circulation there, to help relieve the pain in that area. The MagnaWave, on the other hand, penetrates the entire area. We're not just dealing with one little muscle group here. We're dealing with the entire muscle group area, the bone, the tendon, the cartilage, everything in the area at that time. So again, a microcurrent machine is said to promote healing, to help the body better heal at the cellular level, and a TENS machine will help pain relief in a particular area. That's why you'll see folks that are doing TENS machines on their low back and using them in that fashion, but they're working specifically on that area. So that's a very good question, and that's the primary difference between a MagnaWave and, as Marissa asked, a stim machine or a TENS unit. Great question. Any other questions? Put them out there and I'd be happy to answer them. That's the one I just did. Okay, we're about out of time. I have another meeting that I need to be heading to, so another minute or so. If you have an additional question, please put it out in there, and I'd be happy to answer it. If not, we'll be back here next Tuesday for MagnaWave Office Hours. I'm here every Tuesday morning dealing with questions that folks have. We want to put the answers out there that you're looking for. We want to help you understand what this therapy can do. And if you have questions and you're watching and you want to see, go to the website, look at treatments, and click that. Put your information in, and we'll show you the practitioners that are near to you, and help you better understand and get the treatments that you want, so you feel better and you have good health and wellness. So listen, I appreciate you being here. It's always fun to have this conversation with you on Tuesday mornings, and I look forward to being here next Tuesday to talk with you and answer your questions. Certainly go to our website. You can call the office at any time if you have questions. Send us an email, and we'd be happy to answer your questions. Go to the MagnaWave page. If you'd like to put a question in there, just make a post to the page and ask the question, or send us a message on Messenger, and we'd be happy to, again, answer the questions, give you the education that you're looking for with regard to MagnaWaving and MagnaWave PEMF therapy. Have a great day, and we'll talk again soon. Bye-bye.